Hello, thank you so much for joining us. Today we're talking about mammogram screening guidelines, and we're joined by Dr. Molly Harrison, who is a breast radiologist with Banner MD Anderson Cancer Center. Dr. Harrison, thank you so much for being here.
Of course, it's great to be here today.
Okay, so first question for you. At what age do you recommend women beginning to get their mammograms?
So we recommend for the average risk woman without any breast symptoms to start getting their mammograms at the age of 40, and they should get it every single year.
Okay, so you said average risk, but how would you even know if you are high risk?
So every woman should get their breast cancer risk assessment starting at the age of 25 to 30, and that's done by their medical provider. This takes into consideration your personal history, your family history, any genetic mutations such as BRCA1 or BRCA2, and it calculates your lifetime risk of breast cancer.
So 25 years old is when that should happen. That's much younger than I realized, so definitely good information there to share with our loved ones. Now, when you're looking at high risk, and we're talking data, what are you using to determine high risk?
So the average risk of breast cancer of the average woman is 1 in 8 or 13%. If you are above 20% lifetime risk of breast cancer, you are considered high risk.
Okay, so obviously this is going to be different versus average and high risk, but what are the guidelines that you recommend adhering to for how often we should be getting a mammogram?
Yeah, so if you're high risk, we recommend getting your annual mammogram starting 10 years before the earliest case of breast cancer in your family, but not before the age of 30. We also recommend getting an annual MRI, and that again is starting 10 years before the earliest case of breast cancer in your family, but not before the age of 25.
Okay. All right, great information. A lot of information. Yeah. Thank you, Dr. Harrison. We appreciate it. Of course. And thank you for joining us. If you would like to schedule your screening mammogram, just head to the link in the caption.